So gut and immunity. This is the third role your digestive system plays in your health. 70%, some argue even more, of your immune system is in your gut, okay? So you have the largest amount of lymphoid tissue in your digestive system. And this is where most of your immune cells live so that they can fight pathogens, bacteria, viruses, and keep you healthy. So another reason, incredible reason as to why you need to have really good gut health. Causes of interference. This one's a big one. So dysbiosis. Anybody know what dysbiosis is? No. Okay. So dysbiosis is an imbalance of the good bacteria to bad bacteria. Essentially what you want is you want to have a high ratio of the gut-friendly good bacteria to overcome any of the bad bacteria so that you guys can be as healthy as possible. You can be symptom-free and you can live a vital life. The problem is that due to poor diet, high amounts of stress, environmental toxins, many of us, our microbiome is actually home to billions of very harmful pathogenic bacteria, fungus, yeast, so on and so forth. So dysbiosis is tricky. It's actually those bad bugs are very, very smart. So when you have dysbiosis, it doesn't come on like a classic infection. You don't all of a sudden get sick, you aren't vomiting, you don't have like a fever. Those bad bacteria learn how to coexist with you because it's in their best interest. They don't want you to become uncomfortable. They don't want you to even recognize that they're there, all right? So it's amazing the role that dysbiosis plays in your body. I think we might have another slide that speaks to that. So we know with research that dysbiosis is the cause of many health conditions and diseases, all the way from arthritis to autoimmune to the skin issues like Dr. Ryan talked about, to food sensitivities, to even cancer. And we know that dysbiosis could promote the progression of colon cancer. You guys, I don't know if some of you were at the last makeover event we did. I had shared that my dad was just diagnosed for the second time with cancer, colon cancer. It had metastasized to his liver, stage 4. The first time he had cancer, right before he was diagnosed, I actually met my parents in Las Vegas for one of my family members' weddings. We shared a hotel room together. I hadn't seen them in a long time, and I spent about 4 hours talking to my dad about health and what was going on with his health. And he shared with me all these digestive issues that he was having, and I'm like, oh my gosh, I could totally help you. Why didn't you tell me this like years ago? So I gave him some recommendations. I mean, he had every classic symptom of digestive issues. He was constipated a lot. He even had like sinus congestion, sinus infections a lot. Anyway, he went home. He took my recommendations, but what did he do? Nothing. 30 days later, my mom calls me to tell me that my dad has been in the hospital because of constipation, and they found out that he had stage 3 colon cancer. If I would have known all of this earlier, I would have had him get tested so we could actually see what was going on in his gut. I know just from my experience and all of my education and training exactly what he needed to do, but testing would help him confirm that because, you know, you don't always listen to the people that are closest to you. You listen to some stranger. So it's just amazing how much your gut affects your overall health and leads to chronic illness and disease.